you hear me?
Yes.
Yes. This is Margie. I just wanted to introduce myself. This is our last session of the IPOC IPER documentation. Sarah and Joanne have been doing a great job going over all of this. So today is the last session. We're going to go over goals, indicators, intervention, how to create a new IPOC, create favorites folders, how to delete IPOCs, modify, must-have IPOCs, and then we're going to open the floor up for any questions that you might have. Just so that you're aware, today's session is being recorded, and we're going to share it with the group afterwards, along with this PowerPoint. So with that, I'll leave it for Joanne and Sarah. Yvette, if you can mute your phone for me.
Yes.
Otherwise, we are ready to go.
Thank you, Margie. Hi guys, thank you for attending. So just a brief background on why we are doing this little education. As you all know, Sarah and I used to be the super users when we first went live on Cerner. And just a brief background, because if you remember our nursing process, we have to assess the patient first, and then we formulate our plan of care. You perform all your interventions to address your goals. And then before the end of your shift, you evaluate your IPOC if your goal is met, not met, if it's progressing, and which interventions you were able to do for the patient throughout your shift. Lately, though, we have seen that for the purposes of saving time, people end up doing a reverse practice. So start of their shift, they document on the plans of care. Yes, it saves you time, but legally and in the event of an audit, do remember, should JACO come, for example, or should there be any litigation 5 years down the road, it is very hard to prove that on the first hour of your shift, you were able to perform all these interventions that you say you did. Remember that IPOCs operate on real time. The time that you initiate an IPOC, it's time stamped. You cannot backdate it, you cannot back time it. So the time that it's initiated is the time that your IPOC is active and you are actively doing something for your patient. And then as for the interventions, if you say that you did your interventions, because remember, when you click done, you are attesting that you actually did that intervention for a patient. It would be very tedious to change every single time that you actually did an intervention for a patient. So that being said, I know that all you guys know how to start IPOCs and all, but this is a brief review, and we're hoping that there's a few tips and tricks that you'll pick up along the way to hopefully ease the process and make this IPOC documentation a little easier for everyone. Let me pass it over to Sarah.
Hello, everyone. Okay, I'm going to start right now. First is creating a new IPOC. Click on the Add button under Orders and Plan of Care. And then type the word IPOC and click Enter to search all IPOCs available in Cerner. You select appropriate IPOCs and then click Done. For the goals, indicators, and interventions, a complete IPOC must have at the very least one goal. If you want to put more than one goal, that's okay as long as it's applicable to our patient population. There should be at least one indicator and all applicable interventions. The all applicable interventions is you want to take credit for the things that you do at the bedside. Because if some people will ask, how come you're busy at the bedside? Like for example, for the fall, we don't only put intervention for the fall as fall education. We also put the ambulation assistance, the transfer assistance, and also the toileting assistance, because we do that on all the patients. So take credit for the interventions that we do every day. Any IPOC missing any of these three components will have to be discontinued or modified to contain all three requirements. Click on selected outcomes, indicators, and interventions. But remember that if patient-specific goal 1 is selected, it must be modified to whatever specific goal or intervention is warranted. I will talk about this patient-specific goal later on. And creating a new IPOC and removing unnecessary items. Some plans have pre-selected goals, indicators, and intervention. Unclick goals and indicators that are not being used by our specialty or we are not familiar with. Like for example, Aldrich score, CPOT. The CPOT is the critical patient observation tool that is being used in ICU. The RFLAC is for the face, leg, activity, cry, consolability that is being used for the kids. And also do not put tympanic or rectal temperature. Do not select interventions that are not being done for our patient population. Example, under the pain, when you click it on, it's already pre-filled with the newborn comfort measures. Or collaborate with child life specialists. So we remove those because we don't take care of the kids on our floor. Remember that any intervention you select here will be documented on or before the end of our shift. Okay, this is very helpful using the favorite folders. So once all required, you go to the IPOC, and then once you have the specific IPOC that you want, on the bottom part, save as my favorite, you can do that. So once all required components are clicked, you can add it to your favorite folder to the next usage, and left click on save as my favorite. A small screen will appear, and then click OK to save it. Click the Initiate Now button to activate your IPOC. The other way to do the favorite folder is you click on the word IPOC, and all of those that part of the IPOC will appear, but we don't use all of those. So what you can do is you right click on those that you want to be part of your favorite, such as risk of bleeding, post-surgical, pain management, altered blood glucose, impaired mental status. So once you click those, right click, and then it will tell you save as favorite. So the next time that you use, you have to document IPOC. You don't have to put the word IPOC, or you don't have to put the word post-surgical management or pain management. What you can do is, if you see that icon, the star icon on the upper part, you just click that one, and all those that you have saved will be there. If in case, like for example, you saved them already, but you forgot that you want like restraint or anxiety, you can type IPOC and then add them again. You can revise it. You can add more or delete more. But the easiest way to go is put them under that tab as favorite. So it saves us time doing the documentation. Okay, creating patient-specific IPOC. Click on the box. If you choose the word patient-specific goal, it cannot stay like that. We have to modify it where it will tell us what kind of a specific goal you want for the patient. One example is right-click on that patient-specific goal, and then it will tell you modify, and then you can put like if the patient has Foley catheter or if the patient has central line, then you can put prevent COTI occurrence or prevent CLABSI occurrence. And then once you have that goal, you have to match it with a specific intervention. So right-click on the bottom part where it says patient-specific intervention. So the same thing, you right-click on that, you modify it, and then you put what kind of the description and type in the intervention you want. Example, initiate and maintain COTI prevention bundle. Or for the CLABSI, initiate and maintain CLABSI prevention bundle. So that entails the specific goal that you want for the patient. Okay, and then you just save it and proceed to the next. If for any reason you have to discontinue IPOCs, IPOCs will stay on planned state and deem useless unless initiated. If you see on the left corner, on that red arrow, the orders, the IPOCs, just like the orders of the doctors, has to be bold, activated in order for them to be valid. If you see that pressure ulcer management IPOC, it's gray out, And on the second pressure ulcer, risk of pressure ulcer, it's a CES plan. So if it is a planned state, it is useless unless we initiated it. So make it sure that all of those are bold. So they are activated. Additionally, any IPOCs, any duplicate IPOCs must be removed for easier workflow and documentation. Because sometimes you have multiple pain management, multiple fall. Like in here on the left corner, there's 2 fall prevention. So we don't want to document on duplicates because that's a waste of time. Okay, right click on the IPOC to be discontinued. I'm talking on the right screen on the right corner. And then the screen shows up, keep all the boxes unchecked, and then click OK. Updating the IPOCs. IPOC goals should be current before documenting on it. You cannot just put document in plan and then you proceed to the interventions when the goals have been completed already. So it's not complete. So we check the goals first to make it sure they are current. It is advisable that we review them and then we put 3 additional days because we're supposed to review them every 3 days if the goal is still indicated for the patient. Do not document on IPOCs, as I said, completed status. If deemed necessary to patient condition, a new IPOC can be activated if you want to, but it's not necessary. In order to modify those completed goals, you can right-click on those and then you can modify them to 3 additional days. There are instances when the patient may only need 1 more day for an IPOC to be current. In this case, the same IPOC can be utilized, but the goal date should be changed to keep this current. Right-click on the goal you need to keep and select Modify. The bottom screen shows up, and now the target date can be changed into another 3 days, and then click Sign to finish.
Next, we're going to talk about dual purpose IPOCs, and one of them is your pressure ulcer IPOCs. So, as you can tell on the left side of your screen, it says pressure ulcer prevention and management. For any of your patients that have a Braden score of 18 and below, you want to activate the risk of pressure ulcer, which means you are trying to prevent the pressure ulcer from happening, and that's why you are activating this plan of care. In the event that your patient does develop a pressure ulcer, or if on admission the patient comes in with a pressure ulcer, apart from the first half, you also want to activate pressure ulcer prevention management because this will tell you that you are monitoring the wound for healing, you're monitoring for the status, and you are doing interventions necessary for this patient with an existing pressure ulcer. On the next slide, another very important dual-purpose IPOC is your fall prevention and management. So any patient with a Morse fall scale of 45 and above, you want to activate your fall prevention plan. But should your patient come in and they came in because of a fall, you do not want to activate a post-fall management. The post-fall management IPOC should only be activated in the event of a fall while the patient has been admitted, not when they're coming in after a fall. There are certain IPOCs that are must-haves. For any patient who undergoes surgery, you want to activate a post-surgical IPOC because this will encompass everything you monitor for a post-surgical patient. The risk of bleed, the respiratory status, the surgical site, and the infection. And then any patients who are on any other anticoagulation, aspirin, Lovenox, heparin, Erextra, you want to activate a risk of bleed or a bleeding prevention IPOC. For patients who have a central line, any surgical drains, any Foley catheters, patients who are on antibiotics, your COVID patients, you want to activate an infection prevention management IPOC. And like we mentioned, for patient with a Morse fall scale of 45 and above, you want to do the fall prevention. And for Braden score of 18 and below, you want to do a pressure ulcer prevention. We are on the last few slides. So one of them is the documenting on IPOCs. Again, we want to encourage everyone that the are to be documented on and evaluated at least 4 hours into the shift, not at the very start of your shift. This allows sufficient time for the intervention to be completed in real time. So to do that, you want to click on interdisciplinary first, and that's the very first long red arrow on the left side of your screen. When you click that, it opens up all your active IPOCs. Now remember that you only document on IPOCs that are initiated by RNs, and that's evidenced by the one that has a heart icon on the right side. Because this is an interdisciplinary plan of care, other disciplines such as PT, OT, speech, respiratory are also using this plan of care, and they are responsible for documenting on their own IPOCs. Additionally, like Sarah mentioned earlier, any completed IPOCs need to be reviewed, and either you renew it or you discontinue it, depending on your patient condition, prior to documenting on the said IPOC, so that you don't waste your time documenting on duplicate stuff and things that don't really apply to your patient. Now, to document on your IPOCs, you click Document and Plan, and on the right side of the document, it's going to ask you if the target goal is met, not met, progressing, or adequate for discharge. If, for example, your patient had a bowel dysfunction, had a bowel movement on your shift, no other signs and symptoms, and you feel that the goal is met, it is okay to click Met. And towards the end of your shift, you can right-click this IPOC and discontinue it if it no longer applies. Now, if there's a patient who has nausea vomiting, for example, and you activated nausea vomiting IPOC and you feel that it's still not completely resolved, then you can click progressing towards goal. Any of your patients who are going to be discharged on your shift, you want to document on your IPOC that that the goals are adequate for discharge. Next, you click on the interventions and you document if it is done or not done. And this is what I mentioned earlier. If you're documenting on this on the first hour of your shift, remember we are not allowed to do advanced charting. So it would be very hard to change every single date and time just to say you did it towards the end of your shift, but you're just documenting early. Besides, it's not allowed. And Sarah's going to discuss the last slide.
Okay, it's just for FYI, look closely on the screen on the left side. Here is a sample of an actual patient with multiple IPOCs that were documented on by the RNs. Take the time to clean it up prior to documenting. If a patient is transferred from a higher level of care to our floor, it is okay to discontinue IPOCs that are no longer applicable to patient conditions, such as neuro, like monitoring the intracranial pressure. We don't do that. They do that in the ICU. And if the patient comes over to us, we can discontinue that. So as I told you, look closely. This is an actual patient on the left corner. We can count together how many are duplicates. Like for example, fall is 1, 2, 3. And then the same thing with breast ulcer, there's 1 and then 2. So if you just document it without checking it, you are wasting your time because you're documenting duplicates and it doesn't have bearing. Why would we want to document multiple times on the under the fall or breast ulcer? The same thing with the on the right corner. Look closely also on the orders. There are start from the PCO order. So 1, 2, 3, 4. There are only 4 orders for this patient. But look at the IPOCs. It's like it's occupy the whole screen. Why? It's not because it's necessary, but if you count with me, we can count on the pressure ulcer, 1, 2 pressure ulcer, 3 pressure ulcer. The same thing with the fall prevention. We can count together. There's one there's one fall prevention. There's second fall prevention, and then there's 3 fall prevention. And this is an actual patient. So if we go ahead and document in plan without checking the interdisciplinary, we are actually consuming a lot of times of documenting under the duplicates. Yes, yeah. So note that the as I told you, the interdisciplinary plan is way longer than the actual orders. So it's very important that we check under the interdisciplinary area, remove those that are not necessary, discontinue those duplicates, and then we can proceed on document in plan. All right, thank you.
That ends our presentation.
Thank you, Sarah and Joanne. Do you guys have any questions? Again, it's really important to make sure that you are comfortable with documenting IPOCs and IPERs because it's important for documentation and to make sure that we are monitoring patients' progress correctly. And if you have any questions while you're on the floor, I'm here to help you also troubleshoot it. I'm sure Joanne and Sarah can assist on night shift.
The one thing I've noticed is a lot of our patients are on anticoagulants, and there's no bleeding precautions on these forms. So everybody needs to make sure if they're on the anticoagulant, they add that.
Right. That's important to note. Those patients that are on anticoagulation are obviously a risk of bleeding. Obviously, also that goes for patients that have lab values of low platelets. We got to take a look at those indicators to make sure that we're activating IPOCs and IPERs correctly. That's a good point. Okay, well, if there's no other questions, we're going to go ahead and conclude for today. Thank you, everybody, especially to Joanne and Sarah and Sue for bringing up this issue and for joining us these past 3 days. Truly appreciate it.
Yes, hi, this is Carolina. I wanted to
you.
say thank you. It was awesome, so helpful, and so many people that got the opportunity to learn. So I really appreciate it. Thank you.
Thank you.
Thank you.